We have a personality in the house to really throw more light on this particular discussion. He's no other person than Alison Nafisat, right?
Very
Health
well.
Coordinator, Red Cross Society,
Edo State branch.
Edo State Branch. It's good to have you on this platform this afternoon.
Thank you so much, Mr. Wilson.
Alright.
Good afternoon, dear viewers at home. My name is Alison Omotoyosi Nafisat, representing the Health Coordinator, Nigeria Red Cross Society, Edo State branch.
All right. Well, you heard from her representing the health coordinator. Well, people are like, when they get to hear the word breast cancer, it comes with this great fear. Once you hear someone diagnosed with it, you get to hear someone like you've got it, surviving it, you are going to die. That seems to be the next line of words emanating from persons that don't really understand that particular term, breast cancer. Before we dive into it, give us a brief definition of what cancer really means before going to the breast aspect of it.
Thank you so much. So yes, cancer is a word that comes with so much fear. People tend to see it as a death sentence. But these days we are glad that it is now getting better. It's no longer a death sentence. And so this cancer is something that happens as a result of too much multiplication of some abnormal cells in a particular part of the body. So if it is found in the breast, that's why you hear it's called breast cancer. So some of the cells that are supposed to grow normally, when they begin to grow abnormally, you find that it may be diagnosed as breast cancer. So part of what we'll be teaching ourselves is to understand that you may have some of it as benign, while some of it as malignant. As we go along, I'm sure that we'll be able to clear that difference between
All right. Talk about abnormal growth of cells in the body, but recently we talk about the breast that gives rise to breast cancer. You talk about benign and malignant. Can you please throw more light on the benign nature of the breast cancer, of the malignant nature of the breast cancer?
Thank you so much. So from the word benign, it's something that is temporal, let's say it's transient. So some of these cells are there, they grow abnormally, but if detected on time, that's if you do what we call self-breast examination regularly as a female, even as a male, because males have it too. Surprisingly these days, we find that males have it too, but we have more of it in the women,
female,
with the female folks. So when you do some of this detection and it's detected on time, you find that you get it removed and the person is fine. So there's no much multiplication over time. But for those of the malignant, there are those that grow so fast that even before detection, some of the cells are gone. To the extent that at that point, you can only term it as cancerous cells. Yes.
Cancerous cells. But it's like you have it more on female than the male folks. Is there a reason behind this?
Well, yes. The makeup of a female, from adolescence to adulthood, you find that there's increase in the cells of the female because of that function of breastfeeding and of course our own personal makeup naturally. So that's why you find that if some of these things are not managed properly, you see that it affects the female folks more than the male folks. Of course, the males too, they have breasts, but this their own breast is not as developed and functionalized as that of the females. So that's why it affects more of the females than the males.
All right, so what are the symptoms of breast cancer and how do you feel it can be detected?
Thank you. So, thank God for the World Breast Cancer Awareness Day. And some days ago we had that celebration. And this celebration is one that, reminds us of what breast cancer is and teaches us preventive measures. It also helps us to solidarize with survivors and even those that are currently battling with it. And that's why you see that I'm in pink. That pink ribbon, it stands for strength and solidarity with our fellow women folks, those that are battling with it. Now, there are symptoms that are very, very detectable. As a female, you must be aware of your own body. Yes. So sometimes you find that some of these symptoms are there, some others are not there. But if you start to see unusual warmth in your breast area, or you start to see something like dimpling of your breast skin texture. We call it medically peau d'orange. It means the orange peel. It gives you that look. It gives you such dimples. It becomes, you see, inverted nipple. So as a female that knows that her usual nipple way is that it is pointed, permits me, viewers, to use these words the way it is. You know, it helps us understand very well. So you know that your nipple is a pointed nipple, and all of a sudden you start seeing inverted nipple, something that seems like it's going inside. It is a symptom. Sorry, it's a sign that this is not what it used to be. Then some other time, I mentioned something like the self-breast examination. When you begin to examine, you raise your hands by your head, you share your breast into four, practically for women that do not know, please learn this. Then you massage into your breast the 4 different parts that you have shared into. And at the point where you press your nipple, you notice that there's an unusual discharge. It's also a sign that there is a concern that you have to look into. And so many other signs are very peculiar to breast cancer.
Now, when they raise their hands or start palpitating or touching it, is there anything they should feel? Like, what should one feel to know that he or she is exposed to breast cancer? Is there any lump or anything?
Thank you. Yes, for the examination, it's something that we encourage women to do monthly. So when you do this monthly, you begin to know what is deviating from the normal. So if I do it August and it is okay, September, no lump, no soreness, no unnecessary pain, no unusual discharge, then I'm fine. But at the point when I begin to do it, for instance, in October, and I see that there's a part that begins to thicken other than the other softening parts that it gives, then you know that there's a call for concern. So what you do is to immediately, don't panic. Yes, it's not the time to panic. You visit your healthcare provider that tells you what's next to do.
So if there's a hot sensation or warm sensation, you, like what you rightly said, raise your hands behind your back and start feeling the breast. If there are like lumps or bumps or inverted nipple, that should give rise to concern. That you should go to the health center to verify what is the cause of this particular. You talked about common unusual discharge. Does it have a particular color or smell?
Well, it differs by person. But usually what gives us concern is, you know that if you're not lactating as a woman, you shouldn't be producing or expressing milk. So when you start to see some discharge, like bloody discharge, like any colorful or even clear discharge, it is a concern. So such person has to visit the healthcare provider.
It's a concern. Wow. If you just joined us, this is Healthy Living. We're taking a look at breast cancer, creating awareness for breast cancer. Right now, we'll go on a break. When we return, we'll be taking a look at the causes of breast cancer. Do not go away. We'll be right back. Thank you so much for staying tuned. If you just joined us, this is Healthy Living, reaching you live from Benin City, Edo State, South Nigeria. With me here in the studio, she's representing the health coordinator of Red Cross Society Nigeria, Edo State chapter, no other person than Alison Nafisat, right?
Yes, Nafisat.
All right. So what are the causes of breast cancer?
Thank you. So there are no specific causes, but we call them risk factors. Those things that may build up to be a concern that leads to breast cancer. So some of it may be genetic factors.
Genetic factors?
Yes, some persons have it genetically in their kind of build-up, and so you find that they are prone or susceptible to breast cancer. Then some other persons, it may be as a result of their lifestyle modifications. So what do you drink? Your alcohol consumption, smoking, and even use of hard drugs could make you susceptible to breast cancer. Then some other reasons may be as funny as I want to say it now, is the fact that you're a female, your gender.
Just you're female?
Just being a female. You know, during our program in school, when our lecturers would tell us that being a female alone is a risk, and I'm like, really? So for being a female is a concern, could be a reason that makes you susceptible to breast cancer, because like you asked, when you talked about what makes it peculiar more to the female and the male, the way our body build-up is. There is supposed to be a level of growth, but when it becomes abnormal in the breast cells, then it is a risk factor for breast cancer.
All right, now talk about treatment. Can it be treated or managed? Which is it?
Well, good to know that, yes, it can be treated. But what makes it treatable is early detection. That's why you see that we cannot overemphasize the essence of awareness on breast cancer. When female knows how to do some of this examination, and you do it monthly, you take it as part of your routine, and you get to detect early. You go for different kind of tests. It could be the mammogram that will be done for you. It could be biopsy. They'll take a part of the cell to check if it's benign or malignant. So when you do some of these things and you notice these things on time, it is easy to take off and manage with medications. But at the point where you have overlooked and you have not been able to detect early, you find that you would only be, such persons will be survivors of breast cancer.
Survivors?
Yeah.
What do you mean by survivors?
Well, survivors are those persons that have gone through the rudiments of the cancer itself, the treatment, and somehow it didn't take their life, but it could take a part of their breast or both breasts. Yes, but they are living fine and they are able to, some of them are bold enough to come out to say it to others, to encourage women that are going through that it is not a death sentence, it's something that they can live without. The most that will happen is they may not be able to breastfeed their children, but it doesn't mean that that's the end of life for them.
So you're saying it kind of total removal of the affected or infected breast with cancer?
Yes, there could be total removal of both or that particular affected one, and that still lies on detection early. So if you detect early, it won't spread to the other parts that is not yet affected. So such persons may have just one of the breast removed. And of course, as Nigerian Red Cross Society members, the society is keen on psychological first aid when it gets to this point for survivors, because we understand that emotionally they are down. They feel like, oh, so I'm no longer a woman, or I may not be able to show myself. And this is the part where family and friends need to show 100% support. This is the time where they need to lean on family. So if they are married, they need their spouses and their partners to understand totally with them that this is something that would have taken their lives. But thank God I didn't. They've survived this. But of course, there is something to show for such survival. So these persons need maximum support and cooperation from family and friends. This is not the time to laugh at them. This is not the time to make them feel less of themselves, but it's the time to support them. And that's what we as members of Nigerian Red Cross Society, the healthcare department, are keen on. And that's why we have a group called the Safe Space for Women and even Girls, where we speak to ourselves. We have a group of women that have gone through this and can speak to others as a kind of support that they can even do better than they survived it.
All right, now let's take a look at the myth of breast cancer. Some are saying that the reason why most female gets, infected or contract or develop breast cancer is because they don't get involved with enough sexual activity. How true is that?
Well, that may be true, but not entirely. Now, the reason I said it may be true is usually when a woman is at a reproductive age, between the ages of, let's say, 18 upwards, you find that there's something they say that she should get someone to maybe suck her breast.
Yes.
And that's why early marriage is also encouraged. Yes. So at this time, you have your partners do the sucking for you. Then it could
Does it work?
Well,
because first time I was like, come on, no, this is just me. That would just be like, oh, breast cancer, you have to go through sucking of boobs and that will make it okay.
Some people say that it helps to prevent. I said something about there is no particular cause.
Yes.
Persons are just susceptible to it. So when you do some of those, it may limit the kind of abnormal cell growth that comes up because of the kind of hormonal release of some chemicals in the body. Yes, and because we find out that somehow too there are some kind of hormonal imbalances that causes, that may be linked to breast cancer. Yes, but some of the myths that may be related to it is that it's spiritually inclined, and that's a basic myth that we may not be able to confirm.
Confirm. Okay,
Yes.
say for the spiritually inclined, you say you cannot confirm it, but for the breast sucking, you can confirm it.
Yes, yes, yes.
Quite
please.
funny.
Let's-
Yeah, I'm
yes,
going to ask her this question.
yes, it sounds very funny, but
Yeah.
find out. Yes, it is. It is very, very healthy. You find that even medical professionals say it, that it is okay. Even women that are in between their reproductive ages when they are pregnant too, you find that even midwives will tell them that their husbands to do this regularly for them.
All right, now second myth or that third myth is that some of those women that uses contraceptive or family planning, they are susceptible to breast cancer. How true is this other medical myth?
Okay, for
They
use
talked
of-
about hormonal imbalance and the rest of them.
Yes, you know, for contraceptives, what they do is they sort of arrest some hormones so that there will be no so much reproduction, and so you can time your reproduction
Ovulation, yeah.
cycle. So yes, it may be a reason, it may be a risk factor for it, and that's why when you are on some of those contraceptives, there are some symptoms and signs that you detect. That medical professionals will tell you that when you find some of these things, you are expected to take off such contraceptive mechanism and use another.
Could be pills, injection,
Yes. So they tell you that.
implantation, implants, yeah.
Yes. So they tell you that some may not be adaptable to your system. Some may do more harm than the expected good. So when you find some of the symptoms that they will relate to you, they will now tell you that, oh, this is not compatible with you. Why not make use of injectables? Why not make use of implants? So it may be a risk factor, yes.
All right.
Yes.
Now, what about bleaching cream? The people are like, okay, using bleaching cream, be exposed to cancerous cell. Another myth. How true is that?
Well, I may not be able to say so much on use of bleaching cream, but because, of course, the breast has its own skin texture, and some of this cream may have their constituents that are not so good on the skin texture of the breast, so it may also be, yes.
All right. Well, finally, what advice do you have to ladies now watching us when you talk about the Breast Cancer Awareness Week or day or month? As a woman, what would you advise them to do to at least stay safe when you talk about them being exposed to this bridging effect of breast cancer?
Thank you so much. So one thing to know as females is, like I said earlier, we need to be aware of our body. So if there's any form of change, you're able to detect early and follow it up as soon as you can. Do not joke about it. Some other times as female, we may be the cause of some of our concerns. How do I mean? Some of us use some kind of brassiers,
Yeah.
some bra that can give you some kind of injury to your breast. Some of them that has this iron coating, some of us see it as a way to be fashionable. It's good and okay, but you must be very careful, because when you have some of these iron that are linked to your bra, when they injure you or prick your breast and cause any form of injury, because they may be rusted, you may just overlook it and say, oh, now just small injury. Permit me to use that word. But some of it now links to something as serious as having concerns for breast cancer. So you must make sure that you know how your body works, detect any form of lump, dimple, inverted nipples, and any form of warmness, unusual warmness to your breast skin texture. And if you can do this, I'm sure that you'll be able to detect early and follow up any form of cancerous cell.
All right. Now, one more thing before calling it a wrap on this show. You talked about bra. Some ladies will want to make to be so tight fitted that they start to push their boobs upward just to feel cool or attract the opposite sex. Very, very tight bra. Is it not? Can it really instigate, or will I say lead to or cause that kind of breast cancer? Maybe the breast being so tight, morning, evening, you're just there uptight because of the bra. Some call it corset. They pull it up a little bit.
Okay, well, for corset, it's not really linked to the breast. It's usually for the
waist,
abdomen.
yes, but the bra itself, now push it up a little bit.
Well, for that, it's not a concern for breast cancer.
Okay.
But what may be is, like I've said, because these bras are linked with some iron.
Yeah.
And when they begin to shoot out and they start to pierce your breast skin, then you must be very careful of that, because some of it has led to injuries for persons that have seen, led to injuries that they overlook, and with time it goes to something more than just an injury. So yes, so that's where the concern comes in. But of course, you can do your thing as a lady, but be very careful while doing your thing.
And what about those ions? All right, thank you so much, Alison. I appreciate your wonderful analysis. Well, it's a Breast Cancer Awareness Week, Awareness Day. How aware are you? Have you done the test? Take your hands behind your back. You press. This goes for male too, right?
Well, the male can do
They
that
can still do their
because they are prone to it too.
to it. So,
Yes.
well, though we have lesser percentage of males that can be exposed to breast cancer, but the females, you have to do this test every month. It costs you nothing. Just stand by your mirror, your hands back, and start palpitating. Just press to see if there are lumps, unusual, discharge, or let's say the bending of the nipples and all that. If you detect those, immediately go see your doctor. It's not a death sentence. Some of you that are infected are saying that God forbid you cannot be buried with one breast. You have to let it go. You have to let it go. If it leads to, total removal of it, that's not the end of life. Let that breast go for you to survive. Because these are very adamant. I feel like I came to the world with you.
Yeah.
I must go back with you. No matter
you.
what, I must go back with you. You have to let it go. If they must remove both, let them remove it as long as you're alive. All right? It is not a death sentence. People have survived. They don't have survivors, isn't it?
Yes, they are survivors.
So do the tests. Go to the hospital for, you to live longer on planet Earth. Thank you once more, Alison.
Thank you for
appreciate your coming.
Thank
We'll do this again next week, Monday, God willing. Bye for now.